everybody. Welcome to the Driving with John program. It's Friday, July 31st. Hopefully you're watching on YouTube or you may be listening on WAEM. Either way, we're excited to have you here. We have a terrific lineup of guests, which will provide some updates on some important things going on around town. And I will just do a couple brief updates before we move to our guests. And then we have some time at the end for any questions that you have. If you want to send in a question, you can email it to manager@actonma.gov, or you can call on the phone 978-929-6611. So hopefully, if you've been missing town hall, hopefully you know that we are now providing town hall services to people. If you want to come by, you can't come in the building like you used to, but we have a full service operation in the back. We have two windows open to the public, almost like takeout windows like you would get for ice cream. But we have one side for finance operations and one side for permitting and land use. And we also periodically will be setting up in a tent outside for our targeted programs. So please come by. We're doing this from 10 to 12 Monday through Thursday. And we're working in the building. I'm here today, and we're here most days anyways. So please call if you need anything. And we look forward to seeing you. I know people have really been enjoying seeing members of the public again, because it's been a long stretch. If you come to Town Hall, you may notice that there's some work going on behind the old Asa Parlin House. We have just started the selective demolition to remove some portions of it as we work on a plan to re-envision that building for an amenity for the community and a complement to this complex of municipal buildings downtown. Hopefully you noticed the Board of Selectmen goal setting process that just completed recently. They've established several short-term goals this year and some long-term goals. The number one goal that was established by the board is to establish an Equity and Diversity Advisory Commission. This is a very important project that they want to get started on right away. And they've actually set another date of August 13th where they're going to sit together, the 5 board members, and establish the plan for how to roll that commission out. The board is asking the public to submit any comments and feedback on ideas that you have on what a commission like this needs to do, and any other ideas that you have. And if you go to our website, there's a link right to where you can submit your feedback, or you can always send them into our office, manager@actonma.gov. So that's on August 13th. That'll be broadcast on Acton TV. On August 10th, the Board of Selectmen is holding a regular meeting in the evening, and there's going to be a lot of business discussed that night. One of the major items is going to be calling a special town meeting. As many of you may know, there's a need to have a special town meeting in September. We're still finalizing the date, but we're hoping to do it in the early part of September, and we'll have that announcement on August 10th. So stay tuned and hope you can watch. So let's get right to our guests. We have Heather York, our public health nurse, the director of the nursing program, who's going to provide some updates on where we are with the pandemic locally and some guidance that she wants to make sure everyone understands from the state. Good morning, Heather.
Good morning, John. Good morning, everyone. So in Acton, we have currently 183 cumulative cases of COVID-19 since the beginning of March. 2 folks are still in isolation. I did want to review a little bit about a couple of new things that the governor has placed out. I did talk about the face covering order, that there was a public meeting last Friday through the state to make that a regulation. It hasn't come across the board yet, but there's still obviously the order is in place for people to wear face coverings going into any businesses where you can't socially distance. So there are exceptions, which are for anyone under 2 is not required to wear a face covering, and ages 2 to 5 is at their parents' discretion on how long they can tolerate that face covering. Some of the exceptions are for those folks who don't have some difficulty breathing while wearing a face covering, if there's any behavioral health diagnosis, If people rely on lip reading for the hearing impaired, if you're using supplemental oxygen to breathe, you should not be wearing a face covering. And then for the outdoor areas, if you are exercising and you can socially distance, the face masks are not required. The regulation is going to have specific wording about regulation that says you have to allow people into the building if they give you a reason or tell you they have one of the reasons listed in the exception, but they do not have to tell you exactly what that reason is. They just need to say that I have an exception, I can't wear a face covering, and they're still allowed into the building. So just wanted to put that out. And just remember, if you are someone that can't wear a face covering, you want to make sure you are socially distancing. And if you can't wear a face covering, you really should have someone going into those buildings for you, whether it's the grocery store, the pharmacy, whatever buildings that you're going into. It's important for you to socially distance more than anything. The second thing I wanted to mention was the travel order that goes into effect tomorrow, August 1st. The governor did put that forth, the information out last week. I'm sure people have seen it on the news. There's a requirement that anyone coming from a high-risk state, and there are specific states that are excluded, which are Connecticut, Hawaii, Maine, New Hampshire, New Jersey, New York, Rhode Island, and Vermont. Anyone coming from any other state or coming internationally to Massachusetts, there is a form online that you need to fill out. The form does ask you to list where your home address is, where you are staying in Massachusetts, and this also applies to Massachusetts residents coming back from a high-risk state. So this form needs to be filled out. You need to, the regulation says you need to quarantine for 14 days unless you have had a negative COVID-19 test 72 hours prior to coming to Massachusetts. And you have to be able to show that if asked. So obviously the recommendation is to do that. There is a $500 a day fine that could be given if you are not quarantining, if you are waiting on test results, if you haven't had a test and you're not quarantining. So it's very important that this be followed just for, especially the high-risk states. People coming in from a high-risk state definitely puts the rest of us in Massachusetts who aren't doing that type of traveling. There are some exceptions. One of them is if you are a commuter who typically commutes back and forth to one of the other states or go to school on a normal basis. If this is something you typically do, that is one of the exceptions. If you're doing transitory travel, meaning you're coming from let's say Washington, D.C., and you're coming up to go up to upstate Maine. If you're stopping at a rest stop, that's considered transitory travel, so you don't have to check in at that point. Anyone seeking medical care and the people that are coming with them to assist them with this do not need to check in for that travel restriction. Any military personnel, and then also workers providing critical infrastructure. And there's a whole list on the mass.gov website. If you just go to the most looked at forms, you can find the travel advisory for Massachusetts at the bottom of that, and there's some links to the Massachusetts form. And we have had quite a few calls about this, especially regarding international travel. That wasn't spelled out initially in the order, but it is on the website. Anyone coming from outside of the United States, coming back from a vacation or coming in to visit family in Massachusetts do also have to fill out that form. So just new things for us. We've started our podiatry clinics back in the building. We've had, I think, 4 It's gone really well. We're doing enhanced safety checks. We're making sure we're asking people questions prior to coming into the building, prior to their appointment at reminder calls, and then also after appointments to make sure that no one has had any signs and symptoms of COVID-19. The other exciting news in August, we are having our balance classes outside in the parking lot starting up. Karen Patterson will be doing assessments for balance, and we will be having 2 classes that are running concurrently for 6 weeks on a Tuesday and Thursday. The DPW department was nice enough to put Jersey barriers up in the parking lot just to be for extra safety for cars. And there will, of course, be enhanced safety check-in, mask wearing until you get to your spot in the parking lot, hand washing with sanitizer, and then we will do the balance program. So we're excited to do that. It's nice to see some familiar faces coming back into the nursing department. So we're really happy about that.
Thank you, Heather. Great job as usual, and thanks for all the updates. I'd like to welcome Sharon Mercurio, our Council on Aging Director, who you all know, and welcome back to the program, Sharon. What's happening today?
Thanks, John. I wanted to thank everybody for coming today. It's a great way to try to get information out to our seniors. Our August newsletter hit the streets this week, so lots of exciting things going on here. We are showing pet photos on Facebook this month, so if you want to send us a picture of your pet, that would be great. It's just really kind of neat to share that with each other. On Tuesday, August 4th, we're going to be having a multimedia presentation on the history of 1950s folk music, and that will be on Zoom. We have a watercolor class starting on Zoom, a baseball show, Savon at the piano, a lecture on prohibition. Those are all be coming on Zoom. You can either call to sign up at the COA, or you can email us, and that makes it a little bit easier for us to send you the Zoom link directly. Some of those programs will be shown on Acton TV, some will not. It really is based on the performer. Some of them kind of like to keep their performance special and not have it on Acton TV. But we do have a lot of exercise classes and other programs on Acton TV that have been wonderful working with us. Patsy, our yoga instructor, also has 2 new videos that have come out. Those are on our playlist on the Acton COA website. And then a couple of drive-through activities we have planned for August. James McRae, our Veteran Service Officer, usually does a wonderful monthly breakfast that's extremely popular. So he's going to be cooking and we'll be delivering it curbside. So stay tuned for that. And since everybody's been quarantined, I know myself, it's been a great time to clean and declutter. So we've got a shredding event happening as well. So it'll be a drive-through shredding day. So any questions, you can reach us 978-929-6652. There'll be somebody live answering your phone calls. We do have staff slowly coming back into the building, but IT for the town of Acton did a fabulous job getting us all set up remotely. So we're able to service you remotely as well. Thanks, John.
Thank you, Sharon. So the Senior Center, we're looking forward to continuing the virtual programming and hope to be in person again someday soon. I mentioned earlier that Town Hall, we've had people working here and we're excited to see the public back outside, but there's one facility that's been running full steam without any interruption during the pandemic, and that would be the transfer station. The transfer station is maybe one of our most popular public facilities. Many people will go there once a week, sometimes more than that. And Corey York, our Public Works Director, oversees the transfer station among the many other responsibilities that he holds in the organization. Corey's here this morning to give us some updates on what's happening with the transfer station, and maybe he can mention a big culvert project that I know that is starting soon too. Corey, how you doing today? What's new?
Thanks, John. So with the transfer station, we've been fortunate to, we've been working more since COVID started. We opened it up on Mondays as well. So they run 6 days a week, 7 to 3. We have the first hour dedicated for seniors. So it's been going well. It's been staying busy. People have been pretty good about wearing masks and social distancing. Unfortunately, it's caused some long lines backing up, but we've been working through that, trying to come up with new ways to help people get in and get through. And we've been working with staff as far as reintroducing some of our collection streams so that we can get back to sort of a new form of normalcy. So they've been busy doing a lot of stuff, trying to reintroduce new things back into our program, and just see what we can do safely and provide more for the people. So like we always say, if you have a question about what to dispose of or what to recycle or what we are, just stop and ask the staff. They're always there willing to help. Or you can shoot us an email or a call. We're happy we get calls all throughout the week with people who have something and want to know the best way to get rid of it. So we're here to help with that. Another thing that we did in the start of COVID to help people was we developed an online system so you can go on the town website and buy your vehicle stickers. Just so people know, right now, if you're going online to buy a sticker, it's the prorated sticker for the remainder of this sticker season, which ends into September. So the new stickers that start in September aren't on yet, just so people are aware. But we have talked to a few people, and because they unintentionally thought they were buying the new stickers, so we've worked with them. But we think that will be, we're hoping that will be our major selling point for stickers this year versus buying them at the station with the staff. So I urge people to go on and just see it. It's pretty simple. If you go on the town website, go on the online bill pay, you'll see a tab on the left for transportation vehicle stickers. And we'll be putting the new stickers online probably, I guess we'll put them on in September. So they'll go live so you can start buying those. And hopefully that will make things a little bit better. I think we are looking at getting some kind of an easy up tent for people, so where we're not able to let people in that office space where it's too small. That will have sort of a covered area to assist residents when we're outside if it's inclement weather or too sunny. So we've been striving to try to get things back to normal and provide the best service that we can. So like I said, staff have been working hard. They've been there 6 days a week helping out. So hope to all see you down there. Thank you.
Thank you, Corey. Actually, there's members of the radio audience that are wondering what that squeaking noise is. Can you provide any input on that?
Yeah, those would be my coworkers. I have some zebra finches in my office, so they like to talk when I talk. So I've got 4 of them right now. So you can probably see one swinging on the swing. So just as a quick update too, John had mentioned the culvert project. I forgot to mention. The guys are out working now on Central Street at the town line. We had a culvert that was in disrepair. A couple of years ago, we had put in some temporary piping. Unfortunately, we've had some really wet summers, so it wasn't safe for the crew or the environment to do work the last couple of summers. But the plan is they're out there prepping right now, and they're going to start tonight about 7. The road will be closed. There'll be detours set up to get around it. Our hope is by tomorrow afternoon, they'll have the bulk of the work done and have traffic back open flowing. So fingers crossed everything goes well. And
yeah, it's nice to see that project started. I know we tried to do it several times in the last few years and we kept getting interrupted by rain. So hopefully we can get that done. Nice work, Corey. And thanks for all the updates. So our next speaker is Peter Light, the superintendent of the Acton-Boxborough Regional Schools. Peter is a great partner to me as the town manager here, and we've worked very closely on a lot of things over the last 2 years. And he's had a very challenging summer, really year, I guess you could say. And we're excited to have him here. This is his 2nd time on the program, and we're excited to have him back and learn about what's going on in the schools. And Peter, welcome and good morning.
Good morning, John. Thanks for having me. So with regard to the schools, a few updates for everyone. I'll get to I can't believe I'm going to say this, but a couple of our smaller updates first, and then talk about the big one, which is coming back to school. But, first, if you've driven by our campus recently, we have a large capital project underway, which is our Charter Road redesign project. As part of that, we are working with the Acton Water District and replacing the large water pipe coming into the district. We're also relocating a number of utility poles, widening the road, and creating a 10-foot mixed use path along the campus as a benefit to our students and community. In addition, if you have driven by Gates recently and down towards Spruce Street, you will see that work has actively begun on the building project. We are currently working on preparing Gates to be able to welcome students back, but part of that included being able to take off one of the wings and pods of Gates to allow for construction of the new building. It also includes installing some modular classrooms to make up for those lost rooms. And then we're also working on septic systems right now and a redesign of the entry into the parking lot and a TREP bus loop for students to be able to welcome them back. So lots of activity on the Gates campus. And we'll be continuing that throughout the summer to welcome students back this fall. And then in terms of our return to school, that has really been the almost all-consuming project that we've had for the summer. It's very important for us that we're able to welcome our students back in some fashion this fall. We are currently exploring a program that provides all of our families with two options that they can choose from. One is an in-person option, and then the other is a fully remote option. The in-person option we know is going to have to be based at any moment based on the public health data that's available to us, as well as our knowledge of all the medical guidance and information and the number of cases in our communities, as well as the region. So we're monitoring all of our health data very carefully. We're working with our public health department as well on that. We're very fortunate right now that we have very favorable conditions in Acton and Boxborough specifically, with very low numbers to be able to support an in-person return to school. But we monitor that on a daily basis because we know that could have to pivot. So we're currently planning for a hybrid version of that in-person return. And we've been working with our families and educators to make sure they understand what a hybrid version looks like. Essentially what that means is it will allow students to come on essentially alternating days. There are some more details on our website, but essentially students would attend on alternating days, and one day they would be with us in person, another day they would be remote. And that allows us to only bring in half the number of students in a class at a time and keep our class sizes small. The reason we want to do that is the safety precautions around COVID-19 are extremely important to be able to open our schools safely. And there are three major safety precautions that we know that research has proven effective in mitigating risk. The first is physical distancing, and it was important for us to maintain 6 feet of distance between all of our students and our educators as kids are in school. So the 6 feet of distance, as we worked through testing what our schools might look like in that scenario, if we tried to bring all students back at a time, we could not maintain that distance. If you had been following what the state was looking at, they said you could get down to 3 feet, but they still recommended 6 feet. We've worked with a number of other health professionals who also recommended to stay with 6 feet. So that is the standard that we've set. So that led us to bringing about half of our students at a time. The other requirement that we have is that everyone wears masks when they're in the building. We know that they're, similar to at the town, there will be a few individuals have medical reasons they cannot wear a mask, and we're certainly going to work with those individuals on some kind of an alternative, but we are requiring masks of everyone. And then the third one is really just good hygiene practices. And so we are working to develop really clear plans to make sure that as people come into the buildings, as they change masks during the day, before and after they eat or take breaks, that we build in ample hand washing opportunities for our students. So with those safety precautions, that allowed us to open in person in the fall, and that's currently our plan. We know, as I said before, the major concern that we all have to deal with is making sure that our schools are safe and healthy. But I think as a school district, we also know that we have to balance the health risks with all of the other risks to our students. And, we have to, while prioritizing certainly at the deepest level, the health and safety of our students, but also our staff, because we know our staff are probably more at risk than our students are for transmission of the virus. We have to also balance kids' loss of learning. We have to balance the social emotional impact on our students of not being out. We have to balance food insecurity. We also have to balance parental loss of employment, because that would impact our students indirectly as well. And then really thinking about kids' access to essential services. So it's a very, very complicated situation to open our schools. Health and safety absolutely is the top priority we have, as it should be. But we also have to think about the bigger picture of risk for all of the other factors that we need to consider. So it's a complicated situation. We continue to work through it. We also know that the in-person option may not be right for all families. And we have been working to develop a remote-only option. So some of our educators in the district will teach in a remote-only option. Some will teach in the hybrid in-person option as well. So, it's been a long process. We've had, probably almost 60 educators and leaders involved in the planning process for the return. And it's been a major undertaking for us. And I think we're excited to have an opportunity to see our kids.
Well, Peter, thank you for the update. It certainly is a complex situation. I'm confident that you and your team and the school committee will lead us in the right direction. I'm really pleased with all the work that you've been doing, and thank you for the updates. So that concludes our speakers for this morning on the Java with John program on July 31st. You may be listening on WAEM 94.9 or part of our YouTube audience. In either case, now is the time for you to ask your questions, and we will do our best to answer them live here. So there's been a few that have been rolling in while we've been talking. And the first one is for Corey York. And the question is, at the beginning of the pandemic, there were restrictions on what recyclables were being accepted. Are those restrictions still in place, or is all the recycling available to residents?
We've been able to reintroduce most of the recycling streams back into the program. We still do have a few that we haven't been able to work out, mostly due to the exposure risk for the staff that have to sort the material and go through it, and even just some sensitivity issues. So, but we have been able to reintroduce most of what we collect. So, but we have a little bit more work to do to bring it all back. So we're hoping soon.
Okay, thank you. The next one is related to the fire station. As many of you know, the North Acton Fire Station project was approved last December, and we've been planning it. And actually, we went out to bid, and we just opened bids this week on the project. So we're reviewing those right now, and we'll plan to have an update to the Board of Selectmen on August 10th. But the question on the fire station is, have we done borings yet to determine the subsurface conditions to see whether the geothermal wells will work? The answer to that question is we've done some borings to make sure that we can do retaining walls, but the geothermal borings will be one of the first things we do once we have a contractor on board. So thank you for that question. Then there's a few questions for Peter related to the big school project that is also started this summer. You mentioned it earlier, and these are just a few detailed questions. One is the septic system approved by the Board of Health? Are you taking pictures of the project so people can check it out? And is everything okay with the wetlands?
Sure. So, I think first, we are taking pictures of the project as we go. If anyone in our community would like to see what's going on with the project, you can go on our website for the building project and see updates. You can just go to abschools.org and then click on the building project icon and be able to see some of the different updates. We do send weekly updates out to our mail list. And if you'd like to be on that mail list, you can go right to that website. Again, it's abschools.org and click on the building project icon and sign up for our mail list, and you will receive those updates with, process photos, detailed information on the project and everything else. In terms of septic, we did receive approval of that. We are going to be working with the Board of Health on just defining a couple nitrogen levels as time goes on, but we do have approval of that to continue to move forward with the project. And then I think you had a question on wetlands as well, and that's something that we did have an issue with some wetland where the contractor had disturbed some wetlands. We are working through that issue with Conscom and looking to remediate that and be able to continue to move that part of the project forward.
Great, thank you. Yeah, I look forward. I'm going to drive over and check out the site, or maybe I'll check out the website too to stay away from the construction to see what's going on. So I look forward to learning more about that. Some more questions about the schools, Peter.
Sure.
So one is about what is the process if a parent does not want to send their children to school? And what's going to happen to teachers that aren't teaching?
Sure. So if parents, I think it's important to recognize that for many of our parents, sending kids to school may actually just not be a choice. I think it's easy to understand from some perspectives that it's people choosing options, which technically is correct, but for some people there actually might not be a choice because of medical reasons. So it was important for us to make sure that regardless of whether or not students could attend school, that we provide a high quality education for them. That's also a requirement from the state, that school districts are required to educate students, whether or not they're in person or they are remote. So we have a robust remote learning program that we've developed, and families do have an option of choosing that if they are unable to send their students into school. In terms of, what was the other question? I'm sorry, John, if you can just...
What happens if teachers aren't, what happens if gym class, if there's no gym class, what happens to the gym teachers?
Yeah, so we're working through those details right now. As I said, right now we're in an in-person option. We know that there are some staff that if we do have to be remote, we're going to have to work through a process because there may be some positions that we don't have available because we're fully remote. And we're going to have to work through that with those staff. We are currently working with staff who may have medical concerns that they may not be able to teach in person. But we do have the remote learning program, and to the greatest extent possible, we are working with staff to be able to teach in the remote environment as well.
Okay, well, good. Well, so those are all the questions that we have this morning. And it's been a nice conversation with you and our other guests. I want to thank Heather York, Sharon Mercurio, Corey York, Peter Light, Mark from Acton TV, Brian from the IT department, and all of our listeners and viewers out there. And hope you all have a great weekend. Thank you.